Today, we'll be going over what ulcerative colitis is, so some common symptoms, what actually is going on inside your body, and some treatment options. Inflammatory bowel disease, also known as IBS, is an umbrella term referring to inflammation in the small and large intestine, so the bowel. Ulcerative colitis, or UC, refers to specifically inflammation in the colon or the large intestine. UC happens when your immune system makes a mistake. So normally it attacks invaders in your body like the common cold. But when you have UC, your immune system isn't able to properly differentiate between dangerous cells and your own cells. This autoimmune response causes inflammation and ulcers, which are tiny sores on the lining of your colon. Inflammation usually begins in the rectum and spreads upward, but can involve the entire colon. This inflammation causes the bowel to move its content rapidly and empty frequently. As cells on the surface of the lining of your bowel die, ulcers form, and these may cause bleeding and the discharge of mucus and pus. UC is a chronic or long-term condition. Extreme complications include colon cancer, rupturing of the bowel perforation, and massive hemorrhage. However, most people experience periods of mild symptoms or no symptoms at all, and this is called remission. But sometimes symptoms can return and be severe, which is referred to as a flare-up. Common symptoms are abdominal pain, bloody stools, diarrhea, and weight loss. UC can also cause additional conditions such as joint issues, decreased appetite, and skin problems. Doctors aren't really sure why people get UC, and it's believed that there are multiple risk factors. Genes may play a role, as the disease sometimes runs in families, but environmental factors may trigger your immune system as well. Primarily, it's thought that an overactive immune system is the main trigger for UC. On the mucosal layer of the large intestine, many interactions between the intestinal environment and the intestinal epithelial cells can occur. As I mentioned previously, the immune system of UC patients is impaired. So food, good gut bacteria, and other cells in the colon are misrecognized as intruders. White blood cells that usually protect you attack the lining of your colon instead. The barrier between the intestinal lumen and blood system plays a vital role in protecting us from harmful agents. With someone who has UC, the intestinal cells have impaired barrier function, allowing for harmful microbial products to enter the bloodstream. Additionally, microbes that are not harmful are incorrectly attacked by the immune system in UC patients. So both of these pathways overactivate the immune system. Cytokines, which are chemical messengers, are then released as the immune system is activated. Cytokines are made by numerous cells. This includes immune cells, like macrophages, B cells, T cells, mast cells, and non-immune cells, like endothelial cells, fibroblasts, and stromal cells. The continuous release of cytokines is what essentially causes the chronic inflammation seen in inflammatory bowel diseases. Particularly, tumor necrosis factor, or TNF-alpha, is a key cytokine that plays a role in the pathogenesis of inflammatory bowel diseases. When treating severe acute attacks, TNF-alpha antagonists are a therapeutic option. Antagonists act to inhibit TNF-alpha and thus reduce the potency of the cytokine response. However, this is reserved for severe attacks, as TNF inhibitors repress the immune response and then can make it harder for the body to fight off other infections. For less severe attacks, anti-inflammatory drugs, such as corticosteroids or 5-ASA, are used to reduce local inflammation. 15% of patients also undergo surgery to remove parts of the colon. However, it's important to note that each patient experiences UC differently, and treatment is highly individualized to the needs of the patient. There is still so much more to learn about UC, and further advances in colitis research are developing. If you want to get more information about UC, learn more by visiting the following websites.